Good morning, good afternoon, everyone. Thank you, viewers, for coming. Dear friends, colleagues, hope you enjoyed our previous two videos with Dr. Razan Piyase on the microbiome, and it's a really huge impact to our well-being, our moods, even the diseases such as anxiety and depression that many people struggling. There are a lot of insights for me personally, lots of learning, and I imagine for you too. And also thank you for very clear explanation what it means, and in the lay terms so people can understand. That's very important. So I guess now we're moving to the third part, where we'll see, like, maybe reiterate on the previous two, but also moving to our third question. Since here is targeted approach to reach patients issue in scope of precision medicine, how, in your view, precision medicine can reduce healthcare cost, healthcare burden? Yeah,
Okay.
floor is yours.
Thank you. Thank you. Thank you very much. Really, it's this question is most important. I mean, this is a target of our. Let me see my slide. This is a target of our. Yeah. Of our shifting from taking care of sick disease to taking care of health care.
Mhm.
How we can increase the health care by precision microbiome medicine. Precision microbiome medicine is something wow, something new. This can reduce the healthcare cost in several powerful strategies or ways. The most important, as I mentioned before, we can do preventive medicine, preventing disease instead of treating disease. This is, we call it preventive medicine. Reducing the ineffective treatment. Of course, some people or some doctors, they can do trial and error method. This is if we really supply or apply the strategy of precision microbiome medicine, it will be reducing the ineffective treatment, cutting down of hospitalization and complication. Wow. If we really cutting down the cost of the hospitalization and complication, that's meaning our society will be healthy and happy. Lowering cost of chronic disease management. Of course, everybody may know about chronic disease, from obesity to diabetes to hypertension to autism to IBD to IBS. All this is chronic disease. For this, if we treat properly by precision microbiome medicine, that means we'll lower the costs. What about diet? What about guiding personalized nutrition? And this is the most important. Guiding personalized nutrition, it will help for the disease to prevent. And will help us also. Reducing unnecessary antibiotic use, as I mentioned before. Antimicrobial resistant, it's really a problem. If we reduce the antibiotic, improper using of antibiotic, this will help a lot to know exactly how we can reducing the unnecessary antibiotic use. Especially in my project, antimicrobial resistance microbiome signature, if we really succeed to reach in our own area what is the antimicrobial resistance signature, it will help a lot. Optimizing expensive therapy. How? Here it's come the precision medicine, precision microbiome medicine in cancer treatment. Precision microbiome medicine, it will help a lot in immunotherapy in cancer. Precision microbiome medicine, it will help a lot in also diagnosis of cancer, also in preventive of cancer. That's meaning, or prediction of cancer. That's meaning, really, if we work hard with precision microbiome medicine, it will help us a lot.
Yes, if I may interrupt just for a second. I'm coming from vaccine development for many years, worked in Sanofi, which I call my another university. in terms of development and learning. But this is very like resonating, because prevention is the first. It's almost, we always call upstream the river before the river enters the ocean or the sea. That's when you can actually interrupt work and do something before it, near the delta, when the really little can be done and many suffering happens.
No,
Thank you.
because really, precision microbiome medicine is really a new medicine. We didn't study when we study medicine. I'm graduated in 1977. Now I am in my practice since 46 years, and especially in UAE. I'm in UAE since 1979. And you know, in UAE, before, when I practiced medicine in 1979, we don't have UAE people suffering from IBD. Why? This is a big question. Because now there is something going on the diet, which is make them suffering from IBD. Of course, in any disease, it should be three signature: genomic signature, microbiome signature, and environmental signature. And all these three signature, if work together, it will give either healthy people or non-healthy people. And this is part of it, why I have so many projects the IBD microbiome project, obesity microbiome project, diabetes mellitus microbiome project. And of course, we didn't mention before, I am the owner and the founder of UAE Microbiome Project, and still it's my dream. I hope it will be real in near future. Now, let us go to the last part, the summary of our precision medicine, micro medicine, how we can reduce the cost.
Yes.
This is a mechanism, and this is a cost-saving mechanism. What early detection can help us to avoid advanced disease treatment. You see, oh, it's really big. What personalized therapy can reduce waste and side effects of so many medicine, of so many diseases. Infection control, this is the most important, can cut the hospitalization if we really do proper infection control. A chronic disease control, wow. If we really control chronic disease, we decrease the, lifelong drug therapy, lifelong drug spending. Precision nutrition also, if we call it precision microbiome nutrition, it will prevent metabolic disease. Metabolic disease, it can be obesity, can be diabetes mellitus, hypertension, cardiovascular disease or disorders. All this will help. Antibiotic stewardship, this is the most important, as I mentioned before, reduce antimicrobial resistant related cost, and it will help a lot. And the last one, optimizing cancer therapy. And really, if we really avoid ineffective, expensive treatment, you will have cut the cost as much as we can. Now, all this, it will give us dare to dream how we can change our strategy from sick care strategy to healthcare strategy. And really, I'm happy to work with you. And the last slides, you see microbiome mapping. Microbiome mapping is really paradise for all us, for all scientists, for all, as I am a clinician, clinical innovative researcher in microbiome mapping, it will help a lot. If you saw from this picture, it needs a lot of hours to explain to you about all. But now we can have this in any patient. If we ask about microbiome mapping, it will come like this. I am talking about metagenomic. Metagenomic, it will give us the viruses, we have the bacteria, we have the fungal, we have the parasites, we give us all. That's meaning if we really know our microbiome knowledge, we can innovate and do innovation for susceptibility for our future. Let us work together to make our future bright and happy, healthy, and successful. Thank you.
Thank you so much. This is really amazing. Lots of eye-opening to me. And again, when I hear prevention coming from vaccines, it's really, close to heart.
Thank you.
Yes, I'm just maybe a few questions. When you said testing, what does it involve in terms of testing? It's patient visit the clinic, or it's relatively simple, or it's complicated? Could you just very briefly elaborate?
To make it easy, there is now microbiome testing. There is special kit. We can send it to the patient. I can do the sample inside. That kit, for example, we can do the stool sample, put it in the kit for microbiome. We can do saliva sample, put it in the kit for special kit for microbiome, and we'll send it back to us, and we'll send it to a proper lab. Of course, the most important should ask which lab we are using. I am looking for a lab which can do metagenomic with a clinical translational platform. I am the researcher of clinical translational microbiome platform. Whatever we added, if you see from this slide, microbiome mapping is really huge. But how we can apply this in our clinical practice, this is the most important.
To zoom towards more like scoop the most important
The
part.
most important, how we can use it. How we can use it in personalized nutrition. How we can use it in personalized treatment. How we can use it in our personalized lifestyle. And this is what we call it, clinical microbiome transitional platform.
For me, just learn, I see a lot of potential. And also I see the need to maybe marshal resources from your side, maybe from the collaborator side, and potentially from investor side.
This is the most important,
Yes.
investor side, because if really they know what we are doing, me and you, wow, they will be with us, and we can make our dream real.
Yes, because this has potential to help lots of people. I think it's already happening, through your practice. So if we can scale it up and make it more accessible for people here and people who travel from abroad to UAE, in line with the vision that it would be healthcare hub by 2031, that would be amazing. So with that video, we're reaching out to you guys who is listening. For opportunities for collaboration and again for investment to evolve from this step and to make it meaningful, translational, and also to derive some specific methodology that can help patients.
Thank you.
Thank you so much.
Thank you.
Thank you so much.
Love your microbiome.
Yes, thank you. Bye.